Good evening, Pahrump. I'm Dr. Michael Reiner, your host of this show, The Independent Doctors of Pahrump. And tonight you won't see the recording thing because this is another live version. The call-in number 727-8750 for those who are my loyal callers, Ray and Louie and Chuck. Hope you guys got something, because I never really plan for the show anymore. I used to do a lot of PowerPoint presentations, but I find those usually a little bit boring, and people sometimes get lost in that. So hopefully we get some good calls. If not, we'll always find something to talk about. And one of the things that there really hasn't been anything new or extremely exciting lately in the world of medicine. I know recent new breaking discoveries, some new medications coming out there. So not to be disappointed, Ray. Ray, are you there?
Yeah, I'm here. Are you there?
Oh, good. Yep.
Hey, every time I watch your show, all these different letters appear on the screen, and I says, might as well ask the question, what does like FACC mean, APRN means? And I know CNA is like Certified Nurse's Aide. PA is a physician assistant. Who can prescribe out of all these? I see a MD, which is you, so I know you can prescribe. Mm-hmm. But what are all these letters, and how much education does it take to be like a physician's assistant or anything else? If you can clear that up for me and maybe some of the other people out here, because every time I see these letters, I'm saying, I don't know what that means.
Yeah, okay.
So if you can explain that, and I'll call back later with another question.
Okay, sounds good. Yeah, good point. You know, I never really see it through the eyes of the way the average person that walks into the office sees it. But obviously we know MD stands for medical doctor. DO stands for Doctor of Osteopathic Medicine. And then MD is allopathic medicine, and there are different boards that control that. The osteopathic medication doctors in the past were kind of more holistic. Now this is obviously years ago. This is not recently, but they have a little different path of training. And they were, you know, kind of like, I know some people are going to hate me for saying this, but back in the day, maybe in the 60s, they might have been considered kind of glorified chiropractic type doctors. But since then have come more mainstream. They go through the same, they go through basic medical school like we would go through, but then they go into they do the same residency programs that we do. So the two are really about the same, but I believe, in my mind, the DO board that governs osteopathic medicine tends to be a little bit softer than the MD board that covers allopathic medicine. So, and what I mean by that is a little more punitive for lawsuits, judgments, other things of that nature. It doesn't mean that obviously if there's a gross problem they wouldn't take care of it, because they still are bound by you know, the public sentiment. PAs, or physician's assistants, can be trained in a variety of different fields, and then go to 2 years of physician's assistant school, and then some hands-on experience after that, working with a particular physician. And PAs tend to be a little more specialized in their one field that they choose. They can be a physician's assistant in GI and in some of the specialties, and they're pretty much focused on that. Some of them are actually maybe have some training in basic, you know, medicine. They might have been a medic in the Army. They might have been, but if an RN decides she wants to go further, then she can become an advanced registered practice nurse. Now, physician's assistants operate under a physician's license. They're a physician extender. They are much more scrutinized than nurse practitioners, as far as having to be, you know, oversee, visited, charts reviewed by doctors. So, advanced registered practice nurse basically is an RN that goes to nursing, registered, goes through a higher level of training. They do additional work, and then they have additional schooling, and they have more hands-on experience. The nursing board now has considered them, the state has passed legislature to make them an independent practitioner, so they basically can work, and they wanted to open their own shingle. They don't necessarily need to answer to a physician. Prior to that ruling, they did. Now, then what happens, you get MDs that have, fellow of a College of American Surgeons or fellow to the American Association of Cardiology and all the other names behind that. So that just means they're a specialty board, and they basically have an association. They pass some different testing, and they do things of that nature. So if you're an MD and you go through medical school and you want to graduate, most states won't give you a license unless you're doing some type of internship and residency. So you can do one in family practice, you can do one in, then do a residency in internal medicine, and then go on to do a GI fellowship or a cardiology fellowship, and then you specialize. So you're going to do that residency training, and then you're going to basically go and do a fellowship in your specific area that you want to train in. If you don't want to do that, then you would just do family practice, and you would practice family practice. So that's basically how that particular specialty works. Back when I was graduating medical school, it started to become into vogue to do an internship and residency. Usually some doctors would just do an internship, and then they would go out and start to practice, they would get it by experience. Residency programs in my mind, teach you how to think under pressure and expose you to a lot of diseases. In my mind, I think that's the difference between physician's assistants and somewhat nurse practitioners and MDs, is the level of the way they start to peel back the layers of your problems to get to the answer. And within those, each subsets are a group of people that think kind of outside the box, think abstractly, and can come up with a decent answer. I consider myself a pretty decent diagnostician, because I believe that every disease and every symptom has a story, and you need to understand that story and peel those layers back, and enough of the stories that people will tell you, you can pretty much get your diagnosis down and get a few tests to confirm that. And that's usually the way it is, as opposed to just doing a bunch of tests to try and figure it out, because a lot of those testing will end up confusing you, because unless you knew what you were looking for, it's almost like the lawyer who knows the answer to the question before they ask it, is kind of where we should be by the time we start ordering tests, except when we're doing some screening tests or we want to do those things. So, and that brings up a topic of what is really good to do as far as screening evaluations, and what I would recommend for patients. So when we come back from the break, we're going to talk about, unless we get another caller, we're going to talk about screening tests and what's important for you to be looking at down the road. Thanks for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.